Hello, good morning, everybody. My name is Kelly. I'm a staff from LifePoint. Welcome to LifePoint on Facebook page. This morning, before I start my Facebook Live talk on advanced care planning, let me share with you a little bit more about LifePoint. LifePoint is a program by the Society of Sheng Hong Welfare Services, and we are a social service agency that serves seniors aged 50 and above, and we advocate end-of-life planning. We wish to empower seniors with information and support so that they can plan and give clear directives in matters related to their last stage of life. So at LifePoint, we have public talks like lasting power of attorney, advanced care planning, wills. And after these talks, we also provide one-stop services to all our participants to help them to do these documents at a reasonable rate. Just in case you're wondering where LifePoint is located, we are located at Chinatown Point, a shopping mall in Chinatown at level 4, same level as the Chinatown Community Library. And the nearest MRT station is that of the Chinatown MRT station. So after now, I hope that all of you viewers out there will know a little bit more about LifePoint and what we are doing. So let me share with you this morning on what is advanced care planning. Now, I would agree that I think all of you would agree that Singapore population is rapidly aging. By the year 2030, 1 in 4 Singaporeans will be aged 65 and above. And with 60% of the elderly residents aged 65 years old and above known to be suffering from at least one chronic conditions, for example, like diabetes, hypertension, and high cholesterol, healthcare is an important factor in the overall care plan for the elderly. And we've now been the elderly being more educated with the technological advances in healthcare and the growing acceptance of the concept of having the patient making their own healthcare decisions. Advanced care planning becomes increasingly important and will better prepare Singapore residents for their future healthcare needs and decisions. So how does the advanced care plan, actually the concept comes about? Now, so advanced care plan throughout in my presentation, I will just use the term as ACP. Now, ACP need not actually be limited to people who are ill or people who are old. So when I share a little bit more with all of you, so you'll have a better understanding what advanced care planning is all about. Okay, so how does the advanced care planning, this concept comes about? Now, the concept of advanced care planning was adopted from USA. Now, the initial rollout of advanced care planning was in the year 2011 in the restructured hospitals, and they're targeting at hospital patients. Subsequently, they decided to roll out the people in a community, and LifePoint is one of the agencies that we have trained facilitators to help people to do ACP with the people in the community. And the agencies that is in charge of ACP is that of the Agency for Integrated Care, in short, AIC. AIC was formed as an independent corporate entity under the MOH Holdings to look into the enhancement and the integration of the long-term care sector. And AIC has facilitated training over more than 1,000 ACP facilitators. And they have also organized a lot of awareness talks for hospices, for nursing homes, for senior centers. So for this morning talk, I'll be sharing with all of you what is ACP, the importance of ACP, the components in ACP, and what are the benefits of doing an ACP. And very often we are asked by customers or clients, what are the differences between ACP, AMD, which is Advanced Medical Directive, Lasting Power of Attorney, LPA, and Will. What are the differences between these 4 documents? And what are the ACP developments in Singapore? So what is ACP, Advanced Care Planning? Now, advanced care planning is actually a series of conversations, or rather a discussions, And the focus of these discussions is to really to plan for your future health and personal care. And it involves sharing of your personal values and beliefs, exploring that in certain medical situations, what are the healthcare decisions or treatments that you might or might not want. And very important is to choose someone that is able to voice your wishes if you're no longer able to do so in the future. And last but not least is to write down your wishes and share your plan. Now, advanced care plan can be updated anytime, and it is not a legal document. And advanced care planning is also not limited to people who are old or ill. I have clients as young as in their 30s, and they're in good health, but they still feel that it's important to do advanced care planning. Now, I will believe that all of you will agree that life is unpredictable. So should an unexpected medical crisis happen to you, very often that your loved ones may be asked by the doctors to make very difficult healthcare decisions on your behalf. But the question is, will they know what is your healthcare preference? So during a medical crisis, very often the doctors want to know if the family members, whether do they want to continue with the treatment or whether do they want to stop a treatment. And very often the family members will need to decide. Now the question is, who to decide? And who want to decide? And who dare to decide? And who actually know the wishes of the patient? Now, it is a difficult decision because it involves the life of your loved ones. Now, ACP is not limited only to end-of-life scenarios. It can be also extend to long-term care situations as well. Now, what are the components in ACP? Now, during the ACP facilitation process, it will be a one-to-one form of meeting with the client. So during the facilitation process that we have with our clients, we'll be asking them questions. For example, we'll be asking them on how is life in general to you? What does it mean to be living well? What is your current health conditions? And what steps have you taken to keep yourself healthy? Do you have any experiences in making healthcare decisions for others? Because you know that with the particular experiences, it will actually affect your own decision making in terms of your healthcare treatment. And we'll be asking them as well that what are the relationships that make you feel that you're living well? Many of my clients will share with me that family members, friends, their siblings, their nieces, their nephews are all very important to them to make them feel that they're living well. And what are the important events to them? Very often my clients will share with me that when they are able to regularly meet up with their family and friends, to have meals together, to have birthday celebrations, to celebrate festivals like Chinese New Year, Christmas, all these are important events to them. And I also ask them, what are their favorite food? Food that will bring them joy, and comfort. Okay, many of them also share with me that they are generally more healthy in terms of healthy eating. So many of them shared that they prefer to take more vegetables and fruits. And some of them, they will not like to take more food items. And some of them will share with me that they will take salad at least once a week. And some of them, because of religious reasons, they will abstain from certain food. I also ask them, as a person, what are their favorite pastime? Okay, very often, many of them actually share with me that they love traveling, listening to oldies, watching Korean dramas, doing exercises, walking in parks, attending religious classes. All these are very important to them. At the same time, some of them feel that they love to do volunteering work. They love to serve the community, and they find that making donations is something that they also find that is meaningful to them. And they also tell and share with me that, attending religious classes, attending services, cell meetings are also very important to them. Also will ask them, are there any, if they face any fears, any challenges, how do they usually handle them? And if they have any, do they have any fears and concerns if they are seriously ill? Okay, many of them actually will share with me that, if they are seriously ill, they are concerned that they may be loss of independence. Some of them may be fear of financial burdens and emotional burdens. So after hearing from them what is life in general to them, I also would be asking them about the nominated healthcare spokesperson. In short, is the NHS. Now, NHS is the person that will represent your voice in the event that you're no longer able to do so. Now, I'll be sharing about this a little bit more in my next subsequent slides. And in the ACP facilitations, we'll be also asking you about elements of care. And that may include your preferred place of treatment of care. That means in the event that you're no longer able to care for yourself and you need long-term care, how would you like to be cared for? And we'll be also sharing and asking you, what are your preferred type of a treatment? Do you prefer more of the treatment whereby it's more aggressive? That means the use of more powerful drugs, higher doses in terms of drugs, or because the milder forms of treatment have failed? Or do you choose to have more comfortable care? I also would be asking them questions like, are there any preferred place of death? Whether, do they prefer to pass on at home? And are there any special requests? Requests such as, when they're seriously ill, do they mind to receive visitors? Do they like to listen to any music or chanting? And, when they're seriously ill, are there any thoughts of any funeral arrangements that they would like to have in the event that they pass on? And what type of burial would they like to have? Whether do they want to place their ashes? Where do they want to place the ashes after the cremation? So all these will be shared during the conversation and the facilitations that we have during the ACP facilitations. So what are the benefits of actually advanced care planning? You will realize that as much as possible, you will receive the care that matches with your goals and your values. So let me share with you a little bit about the nominated healthcare spokesperson. So who can actually be on NHS? Now, very often I have clients who actually get their family members to be their nominated healthcare spokesperson. So people like their spouse, their children, their siblings, their nephews and nieces, some of them even choose their friends to be their nominated healthcare spokesperson. Now, so before you choose the NHS, it is important that the person that you choose must be willing to speak on your behalf. And the person must also know you well and understand what are your wishes and your concerns. And the person must be able to tell the doctors about the care that you would like to receive. And very important, the NHS must be able to handle stressful situations as well. And how many can you choose? Okay, very often, most of my clients will actually choose up to 2 NHS. The 4 simple steps actually to ACP. So currently, when you're doing ACP, very simple. First is to think about it, think about the ACP. What is it that you would consider? What is actually living meaningful to you? Understand your current health conditions. Discuss with your loved ones. That is very important, and talk to your family members regarding your wishes and goals for your care in the future. And remember to choose 1 or 2 trusted individuals that can be your voice. Put your wishes in a plan. So record your decisions and wishes and discuss and share your preferences with your family members and an ACP facilitator. And review your preferences. So remember, update your plan if your preferences change. And Do remember to provide the latest copy of your plan to your loved ones so that they will have the latest version. But the current situation is actually many of us actually fear of serious illness, but very few actually make any plans. So what are we people, most of the clients will be share what are the serious, when they have a serious illness, what are they fearful of? Some of them may be fear of dying. Some of them may be fear of pain. Many of them fear that they will be losing their dignity because they need to be cared for by somebody. They find that they are losing control of their life and their quality of life is no longer there. And they find that their life may be meaningless. And some of them, very often, many of them share with me that may be a burden to the family members. Not just financial burden, but also an emotional burden to their family members as well. Now, the advances in medicine and technology have enabled people to live longer, even when a cure is no longer possible. Very often in such situations, decisions must be made about the use of emergency treatments to keep the patient in their current state. And the doctors may actually use machines to help them to do this. So decisions that your loved ones may need to make on your behalf may include things like CPR, the cardiopulmonary resuscitation, the use of ventilator. So let me share with you a little bit about CPR, the cardiopulmonary resuscitation. Okay, this may be done if a person actually stops breathing or if their heartbeat stopped. And it must be done within 10 minutes of their heart failure, because with every minute that is lost, the chances of surviving actually loses as well. Now, so what does it actually include? When you're doing CPR, it includes breathing into a person's mouth and pressing onto the chest to enable his heart to start again. Or it also may involve electric shocks to start the heart. Now, during the process, within 2 minutes, 150 times of chest compressions must be done. And the whole process may last for about 15 to 30 minutes. And the weight itself may involve 100 to 125 pounds. Now, CPR may not work if the person has chronic medical problems, such as an underlying heart conditions or lung disease, or the person, if they have an illness that is terminal, and if the person is old and frail, CPR may not work. And the outcomes of CPR may include rib fractures, there may be permanent brain damage, or there may be a need for them to be hooked onto breathing machines, or a care in the intensive care unit may be required, even if the CPR may be successful. And let's take a look at the success rate. For the hospitalized patients, it's less than 17%. For patients at end-stage chronic illness, it is less than 5%. For elderly who is frail and living in long-term care facilities, the percentage of success rate is only 2%. Now, other than CPR, there may be other life-sustaining treatments. Life-sustaining treatments may be in any interventions that prolong life and may or may not be highly technical or invasive. And that may include artificial ventilations, there is intubation, there is the use of a machine to assist in breathing. Artificial nutrition and hydration. This will happen if the client is no longer able to take food or drinks through his mouth. Other forms of life-sustaining treatment will include the use of antibiotics, dialysis, or any medications or devices that control blood pressure or heart rhythm. Now let's take a look at this particular case, of this particular celebrity. Now the father, this particular celebrity, what happened is that the father was actually in the hospital and the father's heart actually stopped for about 4 minutes. And then the doctors actually asked the family members to make a decision on the spot, whether do they want to try to resuscitate the father. And the doctor told the family members if they choose to try to resuscitate the heart, there is only a 10% chance of the father will be able to survive. And even then, he will be in coma or be a vegetable. So in the end, the family members will only be given only 10 minutes, to decide. They actually have no time, not much time to decide. So in the end, the family members decided to let the father go because they do not want to see the father to suffer anymore. So this is really a situation as what we call as a stressful situation that the NHS might need to make. Now, in the past, at the A&E, the directive was to go all the way up to resuscitate a patient regardless of their condition, and causing some of the patients to pass away surrounded by machines instead of by their family members. But currently, the goal now is to really to provide maximum care or what they call as a palliative care for the patient, and to accord them with dignity in their final moments. Now, palliative care is basically focusing on providing the patients with relief from the symptoms, such as pain, the physical stress, and the mental stress of a serious illness. And the goal of comfort care is to really improve the quality of life for both the patient as well as the family members. So having shared with you what is ACP, now the next slide that I'll be sharing with all of you will be on what is the difference between ACP, AMD, which is the Advanced Medical Directive, the LPA, the Lasting Power of Attorney, and the will. What are the differences between these 4 documents? Now, just like the ACP, AMD is also a document that is very focused on healthcare decisions, except that ACP is non-legal, but AMD is a legal document. Now, this is a document that you sign that will allow the doctor to suspend your extraordinary life-sustaining treatment in the event that you are terminally ill and you're at imminent death. And terminally ill must be decided, and diagnosed, by 3 doctors, and only when the 3 doctors say that, you're really terminally ill, and even with the extraordinary life-sustaining treatment, it's not going to be really to cure you. And only when all these conditions are met, then they will actually look into whether you have signed an AMD. And then if you do have signed, then they may be able to activate on AMD and suspend your extraordinary life treatment. Now, this is a legal document, and it must be signed by a doctor. And this particular document can be signed in a polyclinic or even in the hospitals or even in the family clinics. The next document is that of the lasting power of attorney. In short, is an LPA. Now, an LPA is another legal document. Now, this legal document itself that is signed that allows you to appoint a donee to make financial or personal welfare decisions on your behalf when you no longer have mental capacity. And bearing in mind that this particular document is that you are still alive, except that you have no more mental capacity to make decisions for yourself. So when you lose mental capacity, only then this particular document will be activated. And who can actually help you to sign an LPA? Now, you can actually get a doctor or a lawyer or a psychiatrist to actually help you to sign this particular legal document. So remember, LPA itself is a legal document. AMD itself is a legal document as well. And the last one is that of the will. Now, a will is also a legal document. Now, it's a legal document that you sign that states that when you pass away, after you die, how will you want to distribute, your estate, which is your property and your assets. So this document on will is upon your death. So as long as you're alive, the will itself will not be activated at all. So all these 3 documents they are legal documents, unlike an ACP. and bearing in mind that ACP and AMD focus on healthcare decisions. So ACP, okay, the ACP itself, basically there are 3 types of ACP. The first one is the general ACP for clients who are generally in good health. So this ACP itself is what LifePoint is able to help you to do. The next one is the disease-specific ACP. Now, the disease-specific ACP are for clients who may already have some underlying diseases. For example, they may have like kidney failure, or they may have some form of heart conditions. But however, this particular disease specific ACP can only be signed by a doctor. Now, the last one is that of the PPC. PPC stands for the Preferred Plan of Care ACP. Now, this one is for those who may be having multiple medical diseases and various degrees of functional impairment. And likely they may be staying in the long-term care facilities. And even if they were to pass on within the next 6 months, will not be something that may be surprising. And the PPC, again, must be signed by a doctor. So for the ACP itself, the AIC is the agency that is taking care of it. Now, the LPA itself, the government body that's taking care of it is that of the Ministry of Social and Family Development, the MSF, and the division under the MSF is that of the Office of Public Guardian. They are the division that is taking care of LPA. Now, the AMD is also taken care of by the Ministry of Health. So these 3 documents, the ACP, the LPA, and the AMD are all taken care of in a sense by the government, whereas the will itself is not being looking into by any government bodies. So what are the ACP development in Singapore? Now, the ACP itself can be done in restructured hospitals, okay? And there are also agencies that are in the community that can actually do ACP for our clients. So LifePoint is one of the agencies that we can do an ACP for free, for at least for this year, for clients who are in the community and they are very keen to do an ACP. Now, for clients, if you would like to know more about ACP and where you can actually do it, and you would like to find out a little bit more, you can go to these 2 websites, and you can actually be able to find out a little bit more about ACP, and also the ACP directory, whereby you will be able to find out which are the agencies, the hospitals, that they are able to do ACP for you. Now, for LifePoint, so hopefully, all of you, after listening to this presentation this morning, hopefully all of you can actually start to think about ACP. So for LifePoint, we can actually give us a call at 6538-9877 if you think that you really want to do an ACP. And of course, you can also do it at our Family Service Center located at Hougang. The details are as per what is shown on the screen. And currently for this year, we are actually doing an ACP free for all our clients. So if you are really keen to do an ACP, do drop us an email or you can give us a call, and then after that, we can arrange with you on how we can go about doing ACP for you. Okay, so thank you for this listening to the talk this morning, and hopefully that all of you will start to do some form of planning regarding your ACP. And thank you for your attention.